Welcome back to Soda City Live, everyone. We are continuing our segment on smokers' lines, but never smoke, those little things you get. We're looking at the thinning of skin around our mouths and losing the strength of that natural roll at the lip border. Dr. Smythe Rich and Dr. Kayla Humananski are plastic surgeons. And now we're in Studio A with a patient, Jessica, who I will say you are very brave. She is so brave to be willing to do this. Now, for all of our viewers who don't like needles, I find it absolutely fascinating because I think medical treatments are phenomenal to watch, but we're going to shield you from that, so don't worry. But doctors, if you will walk us through first the procedure that you would be doing right now on Jessica, and he's already numbed you up.
A block.
Yeah, a block, okay. So this procedure is a filler?
This is filler, so sometimes to make lip filler a little bit more comfortable, we do a dental block in the office, which is where we block some of the nerves from the inside of the mouth so that the procedure is more comfortable for you.
Okay, and then Dr. Rich, what do you, this looks like something you'd shave your face with.
Well,
I need that for my legs.
It's a little distraction, a vibratory node that distracts that Dr. Humananski showed to me.
Yeah, show that to me. We've got a minute here. I want to see what that is.
Well, it's you put it near a nerve, and the area becomes confused, and so you come.
So it sends different signals to the brain.
It confuses it.
Okay.
Like getting between two people at a party that are about to fight or something, but it just allows, it's more comfortable.
Okay. And it kind of takes the brain away from thinking about the pain of the injection.
Correct. The nerves generally can't feel the two stimuli at once, the vibration and the pain, and so they get confused.
That's interesting. I mean, that alone, I'm thinking of a lot of things, you could use that for.
Right from Philadelphia.
So
if you look,
yes.
This is Juvederm filler, and they've got different thicknesses, and we like a thin one thick. And you see it's like a gel or liquid.
Yeah, I don't know how close they are to seeing that,
It's in your body naturally, and it turns over every 3 or 4 days. So we have been able to stabilize it. Do you feel a little numb up here? Very numb?
Very, but you can talk.
Yeah.
Kinda. So you went, and just because I want our viewers to know if they choose to do something like this to get rid of the thinning or the lines, you would go in and you numb that area.
Some people do, some not.
Oh, really?
And
Some people, okay.
I think it takes a little extra step. You could bruise doing that. This usually doesn't bruise. I mean, maybe 1 in 10 people bruise with this, but.
And the bruising would last how long?
A week or so. A little extra lipstick helps.
Okay.
And it's going to be swollen. And, and it's going to look different. I mean, you can look the same for free. So we want to make it look different, but we want to have something that looks completely normal, like you haven't been to see anyone.
Right. And then the injections would go, just if you'll point to me where the injections are going to go.
We're going to go between the red-white border and see. Now, Jessica has this beautiful Cupid's bow. This philtral column.
Right.
They're sort of a W.
Right.
So you create that, and that's very appealing and natural. And when you get older, it becomes flat, and it's sort of a straight line.
Right.
And it looks like, anyway.
Yeah, it just looks flat.
And then the lower lip, and they turn into the mouth. So that's why this works very well in younger people, and then older, things like a lip lift or fat transfer are more robust.
Okay, all right. So how many times would you do the injections?
How many sticks? People ask me how many sticks. I say all of them. So
that's a really helpful answer.
The little needle's like 1/2 inch, and so you're going to make 2 or 3 sticks on each side.
Okay.
And if you don't choose to have the numbing, many people don't, we use ice, and this has lidocaine mixed in it, so it starts to numb immediately.
Okay, so I'm going to let you do that, but so I don't lose my job, I'm going to step in front. So if you want to go ahead and I'll just shield you guys from seeing the actual injection. I think you get to see the back of my hair. All right, so you are going right into the lip. You're a brave girl. Don't smile.
Do you feel it?
You feel it slightly? You're amazing.
That's right.
And again, that's going to be about 3 sticks there. Okay.
And then.
Okay, so let's give her a little bit of a rest here. Ooh, boy, one more. Okay, so let's pause you for a second, okay? So we're going to get the other side of her in a minute here. Jessica, thank you. You were a great sport. Dr. Smythe Rich, Dr. Kayla Humananski, thank you so much for this information. I find it interesting because a lot of people say, why do I get those smoker's lines when I've never even smoked? Now we know why. We'll have more Soda City Live, and you get to put ice on that lip. She's already beautiful, even more so now after this. We'll be back right after this.